All right, so the last case study I'm going to be spending a bit of time just emphasizes what we can do with a population cohort where participants have consented to link their administrative health data to our cohort. So one of the things that we're focusing on is with regard to cancers. The cancer registries in Canada are actually well up to date and useful with many great people working on them, largely at the provincial level. Cancer Care Ontario, which is now a different organization, has the Ontario Cancer Registry that they spend a lot of time working with. And so one of the things that we've been doing in Ontario is linking the Ontario Cancer Registry to the Ontario Health Study participants. Everything we're doing in Ontario is also being done in BC, in Alberta, Quebec, and the other provinces as well. In fact, because the BC cohort itself, for example, same thing with Alberta, is actually the participants were recruited as part of BC Cancer Agency or part of Alberta Health Services. Those linkages are actually quite easy to do. And it's actually, you can very quickly get information from those cohorts about, say, numbers of participants who have developed a cancer. So one of the things that we can do is identify in the cohort who came into the cohort, say, healthy, and then has been since diagnosed with the cancer. And then we call those incident cases. Right? So what we then might be able to then track is, say, if somebody's participant has joined at a particular time point, maybe they again gave us a blood sample, and then since then they've been diagnosed with the cancer. Right? So that is really fascinating and fabulous information to have, because you're capturing information that wouldn't again be captured in a clinical cohort, because that person wouldn't have had any reason to give a blood sample or a biopsy unless they were part of a study like this. And actually one of the things that's really been interesting is as I give these types of talks, I was at a Terry Fox Marathon of Hope workshop the other day, and clinicians were coming in to me and say, hey, listen, we've got participants coming into our cohort or into our clinical trial studies, and they've said to us, hey, we took part in Cardigen in Quebec. Is there a way that my Cardigen data could be linked to the clinical trial information? So one of the things that we need to be doing now in the future is actually breaking down some of the silos that we have in terms of research activities so that we can better link up some of the data sets such that we can identify who's got what in various cohorts across Canada. And again, with this linkage data, we can also, as I said before, validate when somebody says they've been diagnosed with the cancer. We call those prevalent cancers. And so this is the kind of information we can capture and pull and now have and seen in Ontario. So anyway, with regard to that, I think this might actually be 2015. These are some information that we have for those individuals who have come into the cohort, provided a blood sample, and been diagnosed with the cancer. And so we can map when, so that's age of the individual on the x-axis, and then the time to diagnosis on the y-axis as well. So that allows us to do some interesting science. What we see, of course, is that rates of accumulation of incidence cancers and prevalent cancers are going up, but also allows us to support some really interesting science with regard to how blood ages, right? And can we use blood going back in time to identify factors that might be associated with a diagnosis prior to previous to a traditional diagnosis. So this is some work that we've been very happy to be part of with John Dick and his colleagues. And I mentioned, I think, this process before. This process, this figure that I'm showing up here is, you can't now go to a genetics conference or a hematology conference without hearing about age-related clonal hematopoiesis. Age-related clonal hematopoiesis is this process that I'm talking about here, where mutations accrue in hematopoietic stem cells, and they are a precondition for developing leukemias, but they also might be associated with the development of many other phenotypes, including cardiovascular diseases. And that's one of the reasons why it's such a topical area of research, is that these mutations in blood are not just associated with blood malignancies, but might also be associated with many other morbidities as well. So John's team published this paper that the folks at OICR, my organization, were very happy to be part of, where we were able to capture events. This was a paper that was published in Nature 2 years ago now, where when we go back into our population cohort, we pull blood samples from individuals that have been known to be diagnosed with a cancer, but when they came into the cohort were healthy. We can see that there are early signatures of those mutations in those blood samples, and those early signatures are almost 10 years prior to the diagnosis of AML, or acute myeloid leukemia. So again, another really great emphasis for why these population cohorts can be valuable. And so a lot of our research at the Ontario Institute for Cancer Research is exploiting that type of utilization, where we have many blood samples from people who didn't develop a diagnosis or didn't develop a disease when they came in, and trying to develop new biomarkers for early detection.